So good morning, everyone. For those of you who don't know me, my name is Kate Marple, and I'm the manager for communications at the National Center. And I suspect, like many of you, this is my favorite day of our work here, and it's because we get to spend it together. And this is my 5th Medical Legal Partnership Summit, and after each one, I always leave trying to describe exactly what it is that happens when we're all in a room together, and every year I fall short. But I know this for sure. When I talk about MLP, the story that I most want to tell is one about all of you. Because long before I think about the social determinants of health, or I think about legal care, I think of this incredible group of innovators, every single one of you who have left the comfort of your professional training because you believe that there's a better way to care for your communities. And that is what I find so moving about this work. And so I think that the power of our MLP story lies in how you change each other and support each other. And it's such a privilege to work alongside you. The theme of this year's summit, which Michelle set up so well in her talk, is how amidst a changing healthcare landscape, we can move medical legal partnership from being an innovation to being a standard part of healthcare. And over the next 2 days, we are going to look at that question from research and service delivery and interprofessional education perspectives. But before we get to that, I wanted to take just a few moments this morning and talk from a communications perspective about some of the barriers we face in making that transition and how we can begin to overcome them. So one of the significant barriers that we face is that this connection between health and legal problems, the very driving force of our work, is largely invisible in the healthcare world. And it's not that healthcare is intentionally ignoring the impact that legal barriers have on health or the role that attorneys could play in alleviating them. Rather, on a whole, the healthcare system doesn't understand what civil legal aid does or how its work intersects with health. And when we begin to look at how legal aid has traditionally conveyed its mission and its value and its impact on services, it's not difficult to understand why this connection goes unseen. In preparing for this talk, I was trying to come up with a way to succinctly articulate the differences between how the legal community and the healthcare community talk about their work. And I came up with a series of word clouds. For those of you who aren't familiar, you take the entire text of a document and a word cloud pulls the words that most frequently appear in the text. The larger the word appears, the more often it appeared in the text that you pulled it from. This word cloud that you're looking at now comes from the 2012 annual report of the Legal Services Corporation. So for the healthcare providers in the room, the Legal Services Corporation is the federal funder of civil legal aid in the United States, and it oversees the work of 136 offices around the country. Now, not surprisingly, the word health doesn't appear anywhere in this word cloud. But more surprising is the absence of any words that have to do with well-being or communities. All of the words you see in this word cloud are process words. They're words like pro bono and cases, oversight, system, and clients. It's incredibly difficult to look at this cloud or read this document and get a sense of why civil legal aid attorneys do their work or what their intended impact is. Alternatively, you'll see here a word cloud that's generated from the most recent annual report of the National Association for Community Health Centers. This is an organization that advocates for research and policies that support the work of our nation's health centers. Here, a sense of mission is a little bit more evident. Obviously, there are large words like health and community, but there are also smaller words like patient-centered care and prevention. The differences become even more clear when we compare the documents that each community uses to argue the need for its services. The legal community in most states produce something that's called access to justice reports. Access to justice reports articulate how easy or difficult it is for people to access legal services and what changes need to be made to improve access to those services. Now, this word cloud that you're looking at now comes from the most recent Illinois State Access to Justice report. The dominant words in this cloud are courts, proceedings, committee, judge, and administrative. Even the tiniest words in this cloud don't allude to who legal services help or what access to those services achieves. The healthcare community argues the needs for its services through a document called Community Health Needs Assessments. And this is something that many large healthcare institutions produce. In fact, the one at Seattle Children's Hospital produced an exceptional one last year. And that's what I used to generate this cloud you're seeing here. Here you see a hospital that's talking not just about health and communities, but also about homelessness and housing, about literacy and education, about families and prevention. You get a real sense from this cloud and from the document it comes from about how the hospital views its role in the community and the problems that it's trying to address. Lastly, I wanted to offer a side-by-side comparison from a single city. The word cloud that you're looking at now comes from the annual report of a legal aid agency in Minneapolis, Minnesota. Now, this report did a little bit better job of talking about children and communities than its national counterparts, but you'll still see that the conversation is framed by words like services and attorney, aid, and association. Messaging is once again driven by process, not impact, and the couple of words in this word cloud that do talk about impact are words like assets and awards. Here you'll see a word cloud that comes from the annual report of a federally qualified health center in the same city of Minneapolis, Minnesota. And you'll see that the words in this word cloud, in both English and Spanish, highlight health and housing, family, prevention, and community. Now, the difference between these two types of reports are stark, and not just because one talks about system and one talks about community, but because the legal aid documents tend to talk about problems and the healthcare documents tend to talk about solutions. It's something I actually noticed about the messaging tendencies of these communities years ago when I was analyzing pictures and text on the websites of legal aid and healthcare organizations, and it's reinforced in these reports. Legal aid tends to tell the story of the problems that people have when they walk through the legal aid door, and healthcare tends to tell the story of how well a person is doing after they've left the hospital. If we're going to talk about our impact and our value, we can't just describe the problem. We have to tell the story of progress. Last year at the summit, I talked a little bit about the importance of leading with the why, and how our most powerful opportunity to build support for our work lies in sharing the reasons why we do what we do, in sharing our values and connecting to the values of others. Now, I know from working with the legal aid attorneys in this room for years now that you are not driven by proceedings or courts or hearings, and that your primary concern isn't about winning assets and awards. Every single one of you cares about and are driven by the health and well-being of your communities every bit as much as the healthcare providers in this room. But when we look at these word clouds and the broader messaging that they represent, we can begin to see where some of this invisibility that I talked about earlier comes from. It's incredibly difficult to read these documents and understand what civil legal aid does generally. It's even more difficult for a healthcare partner or a healthcare institution to look at these documents and see how your work intersects with health. And yet, if we look just a little bit closer, we see that it's all right there. Going back to that same Legal Services Corporation report I mentioned moments ago, we can see that where civil legal aid spent 72% of its time and resources last year went to 3 areas. It went to family law, which was preventing domestic violence and helping to build stable families through custody and adoption. It went to housing to prevent evictions and improve substandard housing conditions. And it went to helping people maintain their income through disability and cash and food and veterans benefits. This is extraordinary and deeply important work, all of which has significant impact on the health of our communities. But it is almost always talked about and framed through a mission of justice and fairness, and described in terms like cases closed and proceedings and regulations. But if we were to apply a social determinants of health framework to the exact same report, we would see that where civil legal aid actually spent 72% of its time and resources was to make sure that people in our community were safe, that they lived in healthy physical environments, and that they had the resources necessary to meet their daily needs. Stop for just a second and imagine legal aid reports and campaigns that talked about being partners in building healthier communities. Imagine reports that measured their impact not by cases closed, but by the number of people in our communities who lived in safe homes, who had enough food to eat, and who had insurance to see doctor when they needed to. I'm telling you right now, it would change the entire conversation about civil legal aid in this country. If we are going to overcome this first barrier and raise the visibility of the connection between health and legal needs, then we have to spell it out in the language that healthcare already uses. We have to move legal aid at large to do more of this, and we have to specifically frame our MLP services in this way so that hospitals and health centers can embrace it as part of the mission of their work. How we talk about it and how we say it matters deeply. Now, by no means am I saying any of this to beat up on the legal aid community or to suggest that the work that lies ahead of us is entirely yours, or even to say that healthcare gets it all right when it comes to messaging. The real difference is simply that healthcare has been doing it, has more experience in this arena. It's important to remember that the healthcare field is constantly redefining health and what the source of illness is. And every single innovation goes through periods of invisibility and skepticism, and these transitions are never easy or fast or cheap. They come with a lot of time and they come with education. This was true of the movement to stop talking about surgery and start talking about prevention, and it's still playing out for the social determinants of health despite the enormous efforts of providers and philanthropy to change that conversation. I also think it's really important to keep in perspective that healthcare makes these kinds of transformations in its work and its messaging with considerable resource advantages over the legal aid community. Just to give you a quick sense of what I'm talking about, healthcare employs a much larger section of the American workforce than civil legal aid. In health centers alone, there are 10,000 doctors and 7,500 nurse practitioners. That doesn't even begin to account for the other members of the healthcare team or the people who work in safety net hospitals. On the other hand, civil legal aid employs just 8,000 civil legal aid attorneys, and they are trying to serve the exact same number of low-income Americans as safety net hospitals and health centers. When it comes to funding, health centers received $3.8 billion in federal funding in the last fiscal year. Civil legal aid received $365 million. And healthcare enjoys one other significant advantage over the legal aid community, and that is that it's seen as something that everyone of every socioeconomic background needs, and so we talk about it and relate to it differently. Civil legal aid is intended to serve primarily low-income people, and as a result, it is misunderstood and marginalized in public discourse because higher wage earners don't need equivalent services and don't relate to it in the same way. But what is so great about medical-legal partnership is the strengths on both sides of the partnership. And this is an area where our healthcare providers in this room and in our communities have much more experience and understand the messages that resonate in the healthcare world. We are counting on you, the healthcare providers who see the connections between legal problems and health problems, to help us spell them out in ways that the healthcare world will understand and in ways that illuminate the public health value of legal care. The attorneys in this room have already done extraordinary work in your programs to educate health providers about the legal problems their patients are facing and why they matter to health. Now you have to reach out to those same healthcare partners for help in framing these conversations. The only way to make legal care visible and necessary to healthcare is to talk about it in the words and values of that community. This is not a conversation that lawyers or your community of origin are equipped to frame. We need our healthcare providers to be our interpreters. Yet, while talking about legal care in a health framework is critical, it is only our first step. Alongside the stories we tell of how our patients' health problems are being caused or exacerbated by legal problems, We also have to tell the story of how MLP is the thing that finally allows the healthcare team to treat that problem. We have to tap into the values inherent in health reform and connect the dots between MLP and the effectiveness and efficiency of the existing healthcare workforce. Our stories cannot stop in describing the problem. We also have to tell the stories of professional transformation and how those professional transformations are changing the way and improving the way we deliver care. And this brings me back to where I started, which is with all of you. The stories that are going to articulate these points are the ones about life before and after partnership. Nurses, social workers, and doctors, what was life like before you had an attorney in your clinic, and what is it like after? What do you know now that you didn't know before? How do you provide care differently to patients? Do you screen differently? Does it save you time in the clinic? Does it reduce the utilization of certain services? For the attorneys in the room, what does it mean to work upstream, and how do your healthcare partners help you do that? What have you learned from your healthcare partners about using data to drive your service delivery and service priorities? And how do your healthcare partners help you work more effectively and more efficiently, expanding your ability to provide more care to more people? I said it earlier, and I think it's worth saying again. The power of the MLP story lies in how you are changing each other and supporting each other when you work together. It's not just about a sense of shared mission. If you just shared a mission, you could do that separately and down the street from each other. The power of this work is about how working together transforms how you're actually delivering care and how you're improving the health of your communities. I know that you have these stories. These stories are why so many lawyers in this room have created an MLP career path for themselves, starting as a law student in an MLP clinic, moving on to get an MLP fellowship, and then convincing a legal aid office that they needed an MLP and getting hired as its staff attorney. These stories are why there are residents who started their careers with MLP attorneys down the hall, and then when they finished their residencies, applied for jobs only at hospitals that had similar programs. And these stories are why a doctor negotiated a lawyer in her contract before taking a job at a new hospital. You've told me these stories. You've said, I can't ever go back to the way it was before. Now it's time to harness those stories and to share them not just with each other, but with your institutions, with your funders, and with your communities. These are the stories that are going to illuminate not just why patients need both of you to be healthy, but why healthcare itself needs this partnership to be at its best. I often get asked by folks, what story can I tell my hospital that will most convince them of the need for MLP? I don't believe that there's a one-size-fits-all answer to that question, but I do believe that the people they need to hear from are healthcare providers. The most credible voice in these conversations are going to be that of the patient navigators and the nurses, the doctors and the social workers who carry the stories both of their own professional transformation and of their patients, who can talk about why they need it to practice and also why their patients need it to be healthy. This has been my revelation over the last year, that we need our healthcare providers to be our messengers in these conversations. Now, I know a great many of you are new to medical legal partnership, but I also know that there are those in this room who've been practicing in and leading this field for 10, even 15 years, and you are ready for the next step. But we have to remember that transformations of this scope take time, and that we are in the unique position of trying to transform the service delivery and messaging of not one, but two established systems of care. These are not insignificant challenges, but I have complete faith in our ability to overcome these barriers together, because this is the most passionate group of people I have met anywhere ever in my entire life. And the 231 healthcare institutions and the 99 legal aid agencies already practicing this work are evidence of our forward movement over the last decade. And to continue forward, to position MLP in the healthcare world, we have to go home to our teams, to our institutions, and our communities, and we have to have the conversations about how we're framing this work. That means that we have to talk to our legal aid offices about changing how we talk about impact and embracing more healthcare or more health in our messaging. It means that we need you to tell your stories, not just patient stories, but your stories as health and legal partners about your professional transformation. And it means that we need our healthcare partners to be our guides and our messengers as we navigate these conversations. That's all I have for today. Thank you so much and have a wonderful summit.